My pleasure. Thank you for inviting me. Chairwoman Schmidt, Vice Chair Dieter, Ranking Member Samani, and members of the House Health Committee, thank you for the opportunity to provide remarks on House Bill 353. My name is Henry Wehrum. I'm an osteopathic physician based here in Central Ohio. I'm an internal medicine specialist, and my subspecialty is nephrology or kidney disease, high blood pressure, dialysis, and things of that sort. I am here today on behalf of the members of the Ohio Osteopathic Association to express concerns about House Bill 353. First, it is important to note that healthcare providers, physicians and non-physicians alike, often work together to provide team-based care to patients. The physician-led team is the best model of care, and physician assistants are an important part of that team. I personally utilize and interact with physician assistants in my practice. I greatly appreciate their expertise and passion. While we may disagree on this piece of legislation, we all work together to keep our patients healthy. As you know, House Bill 353 would change the title of physician assistant to physician associate throughout the Ohio Revised Code. This legislation does not modify the title of physician assistant as it relates to Medicare, Medicaid, or commercial health insurance firms. The Ohio Osteopathic Association is concerned that this change will only seek to confuse patients. By replacing the use of assistant with associate, I believe this bill will blur well-established roles within the healthcare team. The term physician associate may lead patients to incorrectly assume that they are being treated by a provider with training and education that's equivalent to that of a physician. Patients, especially when being treated in a hospital, often interact with multiple healthcare providers. The use of familiar and consistent terminology and titles is essential to avoid confusion about who is responsible for the diagnosis and treatment of the patient. Simply put, equating non-physician titles more closely with physicians devalues the education and training that all Ohio physicians possess, including the 9,000 DOs in our state and the MD physicians as well. In closing, I want to stress that physician assistants are valuable members of the healthcare team. Our opposition to House Bill 353 should in no way be construed as a lack of respect or appreciation for those physician assistants and other advanced practice providers. However, this legislation is a solution in search of a problem. Patients currently understand the role of physicians, physician assistants, and other healthcare providers, and we should preserve those titles that protect those roles. Thank you for your time and attention. I would be happy to answer any questions that the committee may have.
Thank you so much for your testimony. Representative.
My pleasure.
Thank you, Chairwoman Schmidt. Thank you, Doctor, for being here. I have a fond place in my heart for DOs, so thank you.
My pleasure. Thank you for having me.
My thought process, though, is that Ohioans choose who they get to see. They have every ability to be able to look into who they are going to see, and actually, before they even see the individual, unless it's a sudden traumatic injury or trauma, and they don't know what's going to happen because they're in a crisis situation, most patients know to do the research. Secondly, I would say to you that a physician associate, I've never seen one. I mean, as far as with you in regard to what you're saying, a medical student who arguably does academia for 2 years in medical school maybe gets some thousands of hours the next 2 years, but they get the majority of their experience in their residency, in my humble opinion. So having said that, why would we take a position that Ohio patients can't make their own decision at the quality level of care that they want to be seen and do the research on their own to make a decision and allow